Hello, I'm Haley Merrick. I would like to talk with you about an individual in the healthcare community that I see making a difference. Christy Schmidt is the Director of Care Experience at St. Luke's Regional Medical Center. Christy began her educational journey as a music major and then did a 180-degree turn to a nursing science degree. She initially received her bachelor's degree from the University of Alaska Anchorage, and then in 2016 she finished her master's degree from Boise State University. Her master's degree allowed her to have the qualifications to hold her current position and the last two positions she's held in the Luke's system. Throughout her career at St. Luke's, Christy has mainly focused on women's services and has been able to promote from within. In the winter of 2018, St. Luke's restructured their health system to better serve the community. This caused some positions to be eliminated, with hers being one of them. She researched and networked within the system and found a position that was not only new to her, but to the health system as well. As the Director of Patient Experience, she oversees the patient's experience and everything patient education related throughout the entire system. Her job requires hard work, relationship building, and experience. Throughout the week, her calendar is full of different tasks. She states that if it's not there, then it does not happen. Christy likes to have a visual of her tasks so she knows what is expected of her. She believes having good people around you to support, do, and implement the work will help have a great work life. Prioritizing, delegation, critical thinking, and her education helps her balance her everyday tasks. The volume of work and having a limited staff is her biggest struggle. With 2 program managers and a business intelligence officer, time management is key in completing each task. Christy does have plans to expand her team in the future. I hope that I could one day be part of that expansion. Christy's favorite part of her job is being able to go back to the floor and speak with the patients and their families. She enjoys the diversity of interacting with different people and being able to visit different parts of the hospital along with interacting with different teams throughout the system. Mentoring is one of her favorite things to do. She loves to guide and provide feedback to anyone in the community. Recently, she mentored a nurse that works in lactation, and they created rooms for nursing staff members and families to pump within the hospital after having children. Christy sees technology as the largest change within patient experience and education. She foresees patients and family creating a demand for health services and systems that we have not had in the past. We need to change from a provider-driven system to a patient-driven system by creating communication platforms and transparency to patients' own medical records. Shifting traditional medical model thinking and changing from inpatient-centric focused model is important for longevity of the healthcare system. Putting money where patients are getting services, advancing in technology, and understanding what our consumers need to live a healthy and long life is a change that she sees as necessary. Changing from a reactive model to a preventative model will positively impact healthcare as a whole because preventing disease from occurring in the first place will decrease the overall cost of care and increase the chance of a long and happy life for everyone. Her best advice is to maintain networking and partnerships to help you along the way. When people think of healthcare, they think of doctors and nurses. Chrissy stresses that there are so many roles that have a variety of educational backgrounds and are important to provide care to everyone. These can be roles similar to health information technology, data analytics, business, insurance, consumer market, and public health. It is important to understand that as we grow in healthcare, we can continue to take care of our patients. We should not focus just on the health perspective, but also the behavioral consumer-based perspective as well. Healthcare is becoming robust and competitive. Brick and mortar is becoming less of a barrier to healthcare because understanding the marketplace and the needs of our patients is so important. Telemedicine is a broken barrier that is allowing many individuals in remote locations receive medical care. Within the items I have explained to you today, I can see an impact that Chrissy is making within the St. Luke's health system. After spending time with her and understanding what her role at the St. Luke's health system is, I would love an opportunity to work with her and maybe eventually step into her role in the future.